For Steve. Joining us next on the Malsberg Show is Congressman Paul Broun. The congressman has something amazing in Washington, something that's only 77 pages and could get at, replace, and repeal the 2,700-page Leviathan called Obamacare. Congressman, by the time we get done this interview, it might be 2,710 pages.
Well, I think the regulatory rate is growing faster than what you're talking about. But we've got to get rid of Obamacare, and my Patient Option Act will do just exactly that. It is a across-the-board healthcare financing reform that reforms every aspect of healthcare financing, and it will repeal Obamacare.
What is the key element that would differ that you propose that would get at the heart of this?
Well, first thing, we've got to get rid of Obamacare because it's already harming our economy. It's killing jobs today, and we already see how disastrous Obamacare is going to be for everybody. It's going to break budgets, from family budgets all the way to the federal budget. It's going to destroy the doctor-patient relationship. It's going to harm the quality of health care and stop innovation in this country. It's just going to be disastrous if it stays in place. And my Patient Option Act would repeal it. It makes health care affordable for everybody. It will literally make health insurance cheaper for everybody. It provides coverage for all Americans. And it's going to save Medicare from going broke. It does this in a patient-centered, market-based healthcare plan, and that's what my Patient Option Act does in 77 pages.
Yeah, and some of the elements of this would allow consumers to purchase health insurance across state lines, make it easier for groups to establish association healthcare plans. Just as you said, the free market and the normal forces that are out there with everything else, there's a sense, though, and you're an MD, what do you say to people who are skeptical? They say, yeah, this all sounds good, but you don't fool around with healthcare like it's a commodity.
Well, it doesn't deal with health care like a commodity, but health insurance is something that people purchase, and they go and purchase health services from providers across the country. Mm-hmm. And what this will do is it makes health care expenses, including insurance, 100% tax deductible for everybody. It expands health savings accounts and will allow people to own and control those health savings accounts. It moves Medicare to a flexible premium assistance program and establishes Medicare health savings accounts that, again, the patients own and control. It does do the two things that you said. It allows people to buy health insurance anywhere in the country where they can shop for health insurance in any state mm-hmm. and can buy health insurance just across state lines. It does allow people or businesses to join an association. You can have these huge pools across mm-hmm. this nation where people will have a whole smorgasbord of health insurance options where they can buy what's right for their family. It creates a tax credit for donations for individuals when they give money to a free health clinic where, and as an example, we've got Mercy Health Clinic in Athens, Georgia, where I've mm-hmm. spent a lot of my time seeing patients. I don't get paid for it. The patients come in, they have, if they can't afford to pay anything, they don't pay anything. And we've got to stimulate this by giving people a tax credit for contributing to indigent care. Plus, it gives physicians a tax incentive to see patients for nothing in their office.
Okay. Now, this is the Patient Option Act for viewers here to the Malsberg Show. I guess it was yesterday, Doctor, we saw this whole energy drink crisis become more part of the public consciousness. I know with sons, I have teenage son. You see it. We've talked about it. Where do you come down on this? Do you think this was necessary to bring this into the Senate? And if so, what's the danger toward teenagers and a little bit post-teen?
Well, I think people need to make decisions for themselves. Okay. We need to be a nation where people are responsible and accountable for their own actions to themselves, and it's something we see in New York, for instance, where your mayor wants to of New York City wants mm-hmm. to tell us what kind of food to eat and what size drinks what size drinks to have, and this is just an extension of that idea that government needs to make decisions for everybody, for everything, and that's totally wrong. It's against freedom. It's against what our founding fathers meant for government to do, and this intrusion into people's lives has to stop. People need to make those kind of decisions.
I would agree. How do you come down as a physician, though? Have you studied these? Have you taken a look at them? Do you see them just as caffeine, or a little bit more as a layman that I do? It's a little bit more complex than that, and not something that I necessarily want to be engaged in. I don't think it's the most deleterious thing out there, but what's your sense of the science on this?
Well, these high levels of caffeine can cause problems from a medical perspective, but people need to make those decisions themselves.
Mm-hmm.
I'm in the Navy Reserve as a medical doctor. I was deployed to Afghanistan, and I saw those troops over there, those soldiers and Marines, drinking these things that they call monsters, and there was another name for another drink that they drank that was, I was scared to drink them. I was scared to even taste them because of the high levels of caffeine and this energy boosting product. So, but people have to make those decisions for themselves. And what my Patient Option Act will do is it will help people to understand that their decisions that they make will affect them monetarily. And so
we have to be better consumers, just like if we were shopping for a car or whatever it might be.
Exactly.
When it comes to health care, we don't seem to care about the cost, and the people providing it sometimes don't seem to care about the quality.
All that's exactly true. And the thing is, what we have to do is empower patients to make good decisions, where they can work with their doctor to make all health care decisions. But if you give them some economic incentive because they control the dollars, then what they'll start doing, and we've seen it happen over and over again through health savings accounts when they've been put in place in businesses, people stop smoking, for instance. They start exercising and losing weight. They start eating better because those decisions, whichever way they make them, are going to affect them monetarily. And
exactly.
Money drives everybody. So we've got to empower patients to make those decisions, and they have to have the economic incentives to live a good, healthy lifestyle instead of government dictating what people should be doing.
Absolutely.
Let me give you another example.
Sure. We have time, about a minute, Doctor.
Okay. As a medical doctor, I know helmets for bicycle riders and motorcycle riders certainly help prevent head injuries, but it's not government's place to mandate those to somebody who's riding a motorcycle or bicycle. In my opinion, and I'm fighting for liberty here, and that's what this is all about for me.
Well, absolutely. The Patient Option Act. Good luck with this. Please come back again. We'll talk about it because it has all the elements, I agree, that would have people make their own best decision. Thanks very much, Doctor.
Thank you so much. Appreciate it.
Dr. Paul Broun, Congressman Paul Broun, too. Two hats here talking about this. And you heard what he said about the energy drink thing. I think these things are, I'm not going to say dangerous, but yeah, with my kids, not a good idea. Not something that, particularly with younger kids, that they should be engaged in. But he's right. It's up to parents. It's up to adults to inform themselves and parents to have the conversation with their kids. And some of the names of these things, Monster, Red Bull, you've seen the ads. Even Jim Furyk, a golfer, doing them. So it's all over the place. And some of them are relatively like cups of coffee. Others, you heard the doctor, are pretty severe. It's something to take a look at, though.